The following segment is sponsored by Citron Cardiology. This week with Dr. Ben Citron, we're talking prevention by intention. So, Dr. Citron, how exactly do you evaluate a patient for heart disease?
Well, like with all things, the first thing we do is we talk to the patient and we ask them what risk factors they have. And those risk factors we look at are high blood pressure, family history, history of diabetes, smoking, and whether they've had previous heart disease or other problems.
Okay, so what types of symptoms maybe indicate that there is a possible problem there?
Well, the ones we worry about the most obviously are chest pain, shortness of breath, a squeezing sensation, palpitations, the sense that the heart is beating irregularly. We look at swelling in the feet. We ask them if they're having any more fatigue than usual.
Okay, so for people who are maybe intimidated to come in, they're not familiar with the whole process, what do you do in a typical exam?
Well, in the exam, obviously the first thing we do is we take vital signs, the blood pressure, the heart rate, we look at the respiratory rate, and the old saying is vital signs are vital. Those are important. So we want a blood pressure 120/80 or less in most people. Blood pressure will go up if somebody's stressed out or they're anxious, so we don't worry about that too much. But if somebody's relaxed, not doing anything, we want the blood pressure about 120/80. A heart rate between 60 and 100 is normal. The lower the better, as long as somebody feels good. Some athletes have heart rates as low as 45 or 50 and they're doing just fine.
Okay.
And most people breathe about 8 to 12 times a minute.
All right, well that all makes sense to me. What is a common first test?
Well, the common first test in many ways is just examining the patient.
Okay.
So we'll look at the patient, we'll see if their neck veins are elevated. What people don't realize is your neck veins is sort of a fluid gauge for the body. So if you have extra fluid on board, we can actually look at the veins in the neck and see if somebody has too much fluid on board. We also examine the neck and listen to it to see if there's any extra sounds. We call those bruits, carotid bruits. Then we listen to the heart to see if it has a regular beat or irregular beat. Whether there's extra sounds, we call those heart murmurs. And then the last thing we do is we just look at the general patient to see if they have any swelling, which could indicate heart failure.
Okay, so then after that, what is the next step after you've done an evaluation?
The next step would be to do an EKG, which is basically just an electrical tracing of the heart. We put these leads all over the chest and on the arms, and then we take a tracing, and that will give us some information about whether or not there's an arrhythmia or there's some old damage to the heart in the past from a heart attack, or there could be some other warning signs on the EKG that could indicate sudden cardiac death or something like that.
Okay, well, I'm sure you've answered a lot of our viewers' questions. Thank you so much for coming in. We look forward to seeing you next week. And if you want more information about how you can set up an appointment to see Dr. Citron, please check your screen. And in our next discussion, we're going to talk about the full range of tests used to evaluate heart disease. Thanks again, Dr. Citron.